Continuing coverage tonight of the federal ICE crackdown. Tonight, information on sick or disabled undocumented children on public health care in Tennessee will soon be reported to Tennessee Immigration Enforcement. Now, the state health department sent out letters warning parents and health care providers of that change, which is upcoming. Fox 17 News' Karen Aguilar tonight live outside the Tennessee Department of Health downtown with what both sides are saying.
Scott, advocates for undocumented immigrants tell me some of these children that rely on the public health care program are facing life or death, but fear being deported. Republicans tell me, however, the new law requires immigration status to be reported if they use public benefits, but not deportation.
Having to choose between getting the care their child needs or at the risk of, if they do, then they risk being deported.
Gordon Bonnyman with the Tennessee Justice Center says he's fighting for undocumented children who are part of the Children's Special Services Program to not be reported to the state's Immigration Enforcement Division, which he fears could be sent to ICE.
It treats the most medically fragile children that don't have other access to care. We're talking about cancer, we're talking about congenital heart defects, we're talking about cystic fibrosis.
The Tennessee Department of Health sent out these letters to providers and parents of children in the program, which pays for health care, saying, after June 30th, the child's information has to be reported to the Tennessee Department of Safety as required by law. House Assistant Majority Leader Mark Cochran sent Fox 17 News a statement which reads in part, the new law does not deport children receiving life-saving care or deny emergency medical care. It simply ensures Tennessee public benefits are reserved for those legally present in the U.S. and directs appropriate referrals to ICE while fully upholding all federal mandates for emergency and life-saving care.
We don't think that these letters reflect what the legislature intended. We think the law is not clear and that it's been misread.
I asked a spokesperson for the Tennessee Department of Health, could this possibly be a misinterpretation of the law? I have not heard back yet. I also asked how many people are expecting to receive those letters in Nashville. I was asked to file a public records request. Families now have less than 3 weeks to decide if their sick child will continue in this program, knowing that information will be sent to the state's immigration division. Reporting live in downtown, Karen Aguilar, Fox 17 News, your Code Red station.